This medicine ECG review will focus on case number 14 from ECG Wave-Maven. Copyright information is provided here. A 36-year-old male with the development of chest pain at rest was transferred for cardiac evaluation after a presumed myocardial infarction. However, serial cardiac enzymes were negative. This ECG is most consistent with which one of the following? The answer, apical hypertrophic cardiomyopathy or Yamaguchi syndrome. This ECG shows sinus bradycardia at a rate of about 58 beats per minute. We see that there is marked left ventricular hypertrophy and unusual, very deep, giant T-wave inversions in the precordial and the limb leads. We see ST depressions here in the lateral leads, and Yamaguchi's cardiomyopathy is characterized by isolated apical hypertrophy. The surface ECG shows left ventricular hypertrophy and T-wave inversions predominantly in leads V3 to V5. However, it can often present in other leads. Apical hypertrophic cardiomyopathy, as well as more common forms of hypertrophic cardiomyopathy, are important causes of pseudo-infarct patterns. This is a apical two-chamber view of a patient with Yamaguchi variant hypertrophic cardiomyopathy. The transducer held to the chest at the apical impulse projects from the top of the image to far field tissues at the bottom. The left ventricle has apical hypertrophy. The endocardium is delineated by the dotted line here, which is easier to appreciate on the moving images. The mitral valve and the left atrium project at the bottom of the image.